Right, let's try again. So I was live a couple minutes ago and you guys couldn't hear me. So as you come in, I'm going to give it a few minutes. As you come in, do me a favor, let me know if you can hear me. As you come in, let me know where you're watching from and then just confirm for me that you can hear me. If you can't hear me now, I don't even know what to do at this point. So let me know as you come in that you can hear me. Let me know. Let's see. Let me know down below. I see somebody just came in and liked the video. Okay, good. Hey, Tanika. I'm glad y'all came back. Okay, good. Thank y'all so much for coming back. Okay. I see. What is this? Let's see. Kiana. Um, what's this? Nashima. Hey, Nashima. Life with Naomi. Cameron. Okay, good. Sugar Girl. Okay, Destiny. Hey, y'all. So what I was saying was, I was just saying that it's Friday night. I was saying happy Friday to you guys, just seeing how everybody's doing, how y'all week been. See if you guys have any questions or anything to share. Anybody pass certification this week? Is that Elsa Fessation? I'm sorry, y'all. I know sometimes it be multiple names in one. Shakim. Okay, Jacqueline. Okay, y'all. Hey, y'all. Now I'm trying to figure this out. What is this that I'm looking at, y'all? Because I know I'm not live on my phone a lot. So for people that's blue, are y'all like, is this my moderators that's blue or are y'all members? Are y'all members of the channel? I started the membership on the channel. I didn't even realize I had members. So shout out to you guys that became members of my channel. I know I made the option available, but YouTube never notified me like, hey, you got members now. I just happened to see that I have members. I was like, wait a minute. How I get all these members? Any advice before officially take my exam? Yes, ma'am. Make sure you're checking out my videos. Make sure you print out or download the test plan for the test you're taking. Use it as a guide. Check off everything you do know. And then everything you don't know, go back to that portion of the study guide. So, yes. Same thing for anybody that's retaking the test. If you're retaking it, whatever score you got the first time, look at your score report and double down on studying the areas that you or that you scored lowest on. Nasia says, what is lab assistant interview questions? They may ask you some scenario questions that you've dealt with patients. They may ask, different they may ask your knowledge about, since you're working on the lab, they may ask you about the order drawer. They may ask you, what type of scenarios you've been in, any mistakes that you've ever made. They probably just want to test those type of things, the scenarios, and then also just making sure you know basic knowledge of the lab, maybe. Nursing school in 2 weeks. Okay, Tanika, my cancer is officially no more. Yes, Jaylee. JD says, my cancer is officially no more. Thank you so much for everything, Kendra. Also, I'm officially in phlebotomy school. Awesome. I feel like I owe a lot to. Oh, JD, thank you so much for sharing that. I'm so happy to hear y'all. Send JD some love. JD says, my cancer is officially no more. I remember when you first shared that you were dealing with that, and I'm so sorry you had to deal with that. But I'm happy to hear that your cancer is no more. Happy Friday, Cameron. Congratulations on passing. I finally caught you live, Cherokee Girl said I finally caught you live. Congratulations. Happy Friday the 13th. Ain't it funny that this is Friday the 13th and last month we had a Friday the 13th and last month Friday the 13th was actually the day that I moved. So y'all probably heard me announce it already, but I have officially relocated down to Georgia. And it is today makes a month. It was Friday the 13th last month that I moved into down here in Georgia. I test on the 23rd and I've been watching your videos for 6 days. I know that's right. You tuned in. You are tuned in, Jess McIntosh. Hey, Miss K, I just passed. Congratulations to you as well, Destiny. Oh, moderators. Okay, that's okay. It looked different now. It used to be it was blue before, but it's a different kind of blue now. It's like a shield beside it. So that's good to know. Thank y'all. I passed my CCMA last month, pharmacy tech on the 21st. Good luck with that one. Cameron says, all your videos are so helpful. Thank you for helping me pass. You are so welcome. What if you took a test a long time ago and then I passed and want to start studying to take the test in about a month? What do you recommend? That is a really good question, Kay, with the play. So, and this is for anybody who is preparing to take certification and you've been out of school for a long time. So, marefreshercourse.com. Jacqueline, I see you on here. Jacqueline, do you mind putting that in the chat? www.marefreshercourse.com. If Jacqueline can put that in the chat, or anybody can put it in the chat, I will pin the comment. But so I created the refresher course for anybody that's been out of school for a long time. Anybody that's still in school and need to pass, you want to take something like that because it's literally a refresher. Since you went to school a long time ago, and you want to start studying again, you don't have to go back to school. That's another question a lot of people ask, and you do not have to do that again. So just get prepared by using the MA refresh course. You can also check out my videos on this channel as well. Oh, thank you so much, Belanta the vegan. Can you help me with how to get CEUs for MA? I need to recertify before October. So whatever organization you got certified through, when you go to that website, they tell you how to get CEUs. If you got certified through the CCMA, I'm sorry, through NHA, all you have to do is just go to the NHA website and then go on there and do your CEUs. They have free ones and they have paid ones. So you want to navigate to the free ones, but every organization has a way for you to get CEUs. Your CPR class also is a way. So when you get recertified, you let the CPR instructor know that you need CEUs. You can get it that way. You can search. Also, you can go on Google, see if there's any networking MA networking events going on in your area to see if they are offering any CEUs. So basically, mainly, yeah. So like with Naomi, if you're the person that was asking about, oh, thank you for sending me the gift, Soraya. If you're the person that was asking about retaking the test, yes. So when you are retaking an exam, you look at the areas where you scored the lowest. You look at your score report, all of the areas where you scored the lowest, that's what you want to restudy again. Focus on those areas. Okay. You can review again the areas you're comfortable with, but you definitely want to review your Oh, Soraya. Soraya sending me all these gifts. Thank you so much, Soraya. So yeah, all of those areas where you feel short, and then you can look over the other areas as well, but definitely start with the areas where you scored the lowest. It'll say below the passing standard, and that's how you know what areas you basically didn't pass in. Also, my name is James. Maybe you told me that before. I'm sorry if I forgot. James. Jaylee is something I got off a random name. Oh, got you. Okay, James. What's funny, James, is that I literally just got off a Facebook Live with my friend James. He's like a brother to me. We just literally did a session together on Facebook Live. So I will not forget that, James. Um, let's see. I got certified to do phlebotomy through the NPCE. Congratulations. I think you did tell me that, Sarai, that you got, or is this new? I know you got certified before. This must be new. Danny, shout out to Danny. Danny is a member of the channel. Danny LaFleur. I don't even want to say that wrong. I said, let me see. I'm just going to say Fluellen 3968. Congratulations. And you're a member on the channel. So thank you guys for becoming members. I was just saying, I did not even realize I had members on the channel. So thank you guys that have become members. I got to start doing something for the members. Maybe I'll just do separate live videos for the members and stuff like that at work. But hey, Alexis. The Hi, I start the program. Margarita says I start the program tomorrow. So tomorrow on a Saturday. Okay. Well, I'm glad you're here getting a head start. Don't try to get into the certification content just yet, Margarita. Focus on, your schoolwork and stuff. You can watch my skills videos and stuff. That's going to help you while you learning that stuff in class. But do not overwhelm yourself, okay? Oh, Tanika gave some advice about the CEU. She said, check with the company you're certified with. They may offer free CEUs, and also depending on where you work, you may be able to take the training you do for work. Yep, that's true. Thank you for answering that, Tanika. Okay, so Jacqueline put it in the chat for me. Thank you so much, Jacqueline. Let me pin this. So for anybody that's interested in the MA refresher course, I had pinned it at the top. Jacqueline was so gracious as to type it for me. Thank you. But that is for anybody that is preparing for certification, whether you are still in school and preparing, or you have been out of school for a long time and need to prepare. It's MA refresher course. And make sure you get the clinical one if you're taking the clinical test, because it includes both clinical and administrative. If you only need administrative, then you get the administrative one. Do you know anything about medical terminology, ma'am? Bel Air. Hi, Bel Air. And you're welcome, Anthony. So yes, I know a lot about medical terminology, and I will say this. Medical terminology is like using it's like learning a new language. So you definitely want to create flashcards and stuff. And I would say Bel Air and anybody else that's about to learn terminology, especially for the person that said they're starting school tomorrow, make sure you really focus on the body parts. You want to know the body part. You want to know the terminology for every single part of the body, and then you want to have flashcards. So as you're learning it, terminology, add them to flashcards, and then just randomly have somebody quiz you from those flashcards. But yes, so Bel Air, if you go to my channel, I do have a medical terminology video on this channel. Thank you so much again, Soraya, for all the stickers. I'm seeing them in the chat now. I have a new teacher. She really don't explain anything. So what can I do? I got 3 more weeks until I take it. Okay. So if you're having issues with being I do hear that a lot. Unfortunately, a lot of times, especially if you're in an accelerated program, a lot of people are feeling like they're not getting the support that they need. So I would say definitely if you're preparing for certification, make sure you're checking out my videos. If you want to get my MA refresher course, you can do that. But then I would also ask if you had a conversation with her or maybe the dean at your school, because I wonder if this is a situation, like I'm just wondering what kind of situation this is, if it needs to go higher to like the dean or the program director. So I would say maybe have a conversation with the teacher and be open and honest about the fact that you're still not understanding it, and then go from there and then see what happens. And if it's like you're brushed off, then you maybe want to go to the dean or program manager. But if it's a situation where your teacher's apologetic and she's like, oh wow, I didn't realize, then you guys can maybe work on something, how she can maybe explain it to you better, or maybe some extra tutoring on the side. I'm not sure. But I would say try to have that conversation first, because as an instructor myself, everybody learns different, and sometimes I can be teaching one way but then you're not understanding it that way. So I always tell my students, please let me know if I'm not explaining it clearly. If it's something you're still not getting, let me know. Sometimes it's me, sometimes it's the student, but we really won't know until we talk about it. So I would say just be open with her about that if you're comfortable with it. Metamorphosis. Hey, Metamorphosis. I'm going to start a job as MA. I'm so nervous. I don't have hands on experience. My program was 100% online. Oh, that is a really good. I'm glad you brought that up, because I've had people ask questions like, what do I do about starting on a job? And my program was online. So this is what you're going to do, Metamorphosis. What specialty are you working in? You don't have to answer that and necessarily well, you can if you want, but I'm just asking this as a rhetorical question for you to think about it. Think about what specialty you're about to work in and go find some videos on that. For an example, if you're about to go work in pediatrics, look at some videos on how to measure height and weight, head circumference on a child, right? If you're about to work in cardiology, look up EKG videos. Phlebotomy, look up phlebotomy videos. Whatever practice you're about to work in, whatever specialty you're about to work for, just look up videos relating to that specialty. So that way, when you go in person and you let them know, my program was 100% online, so this will be my first time. At least when they show you everything, you will have seen videos. Okay. So you will be, at least comfortable enough because you have seen it. Okay. So just look up videos, and then just as much as you can, soak it up. And then when you go in person, just be honest with them about the fact that this is your first time. And hopefully you shared that with them in the interview, that you were brand new and 100% online. And so that way they're already expecting to have to train you. I'm blessed and highly favored. I know that's right, Soraya. I failed my math test. Oh, I'm sorry to hear that, says your boy Jaden. I'm sorry to hear that. Are you in a degree program, Jaden? I know with the MA degree program, you have to take math. Usually in MA programs, just the diploma program, you get a little medical terminology. So maybe you're talking about that, but I will watch some videos on that as well. I take my exam on the 17th. Is that Vanessa? Hey, Vanessa, another member. Look at y'all. Look at y'all members of the channel. Listen, Vanessa, good luck with that. Good luck to everybody that's about to take your test. Stefan. Hey, Stefan. Bel Air says I'm an EMT trainer for my school. Oh, okay, that's awesome. And you 17. Wow. Bel Air says I'm 17. I'm an EME trainee. Okay, I thought you said trainer. Okay, I'm sorry. I thought you said trainer. I was about to say already. That's awesome, Bel Air. I'm so glad you getting started early. I love that. I had some high school students one year. We had a summer program, so I had high school students, and I love to see you guys starting early. I love this. So, are you going to be a firefighter as well, Bel Air? In DC, well, I just moved from DC, but in DC, in order to be an EMT, you have to be a firefighter too. Like they used to do them separate, where you could be an EMT and then a firefighter separately. But now, to be an EMT, now you have to be a firefighter. James said, I was recently reading an article about racism in hospitals. What advice would you have if you encounter racist patients? So I have encountered a racist patient, and I did share that on my channel. So I went and got my manager. And I did not engage with the patient when he called me. Well, I actually had two racist patients. And I got the manager. I did not go back and forth about it when he called me the name. I simply went and got the manager, and then that patient was banned from the practice. So any type of harassment, racist remarks, discriminatory remarks, and all of that, our company did not play. Like they got rid of that patient. So I would not engage. It's just, and that's with any difficult patient. You never want to match, and hint, hint, that's a test question too. When you have patients like that, you never want to match their energy. You always want to just escalate it to management. It's Danielle. Okay, got you, Danielle. Thank you. I just didn't want to say your name wrong. The name is spelled differently from got you. Thank you for spelling it that way. Thank you. I don't want to mispronounce anybody's name. You inbox me on TikTok. I only have a few days to study. Oh, okay, TikTok. Yeah, that's why I missed it. I mean, I get a lot of messages on Facebook and Instagram too, and TikTok. Like, oh my goodness, that's a whole nother thing. Um, Abby, hey Abby. Hey, I'm taking an exam next month. So nervous, but I'm praying through it. Listen, it's normal to be nervous. It is okay, but make sure you are studying. Make sure when you got somebody, you give somebody your notes so they can ask you random questions from it. Use the test plan, whatever test you're taking. Look up the test plan and download it, and check off everything you know and everything you don't know. Go find out. That's the best way to do it. I didn't finish the text. I finished in May of last year. I hope I can. Sorry for some reason I keep sending before. I get it, Vanessa. That happens to me too. I take that on the 17th. Do you think I could study? Oh, yeah. What's today? Today's the 13th. Yeah, I think you can. I think you should focus on your weak areas right now. So whatever area you struggle with, Vanessa, because you're taking it in 3 days, I think you should focus on your weaker areas and go to my videos, my study videos on this channel, and focus on the open-ended questions since you are about to take your test. Oh, family practice videos. Okay, so injections. Look up injection videos, metamorphosis, because you're gonna be dealing with adults and kids. Injections on adults and kids. Actually got some videos on my channel on injections. Phlebotomy. I don't know if they're gonna have somebody doing that or you guys are gonna be drawn to. Vital signs. It's so many different things you may be doing. Urinalysis. So look up those type of things. So injections, phlebotomy, EKG, what else? Urinalysis. Um, it's so many things you could do in family practice. Peak flows, eye tests, using a Snellen chart. Family practice could be anything. And that's the good thing about family practice is that you're going to be doing so many different things that you want to know which area you really want to work in because you're going to be doing so many different things. Oh, I'm sorry to hear your dog died, Sean. Sean shared my dog died. I'm so sorry to hear that. You're welcome, Metamorphosis. Okay, you did share that. Okay, perfect. Irene says, I took a break from medical assistant. I only had 10 months of experience. I can't find a job in Inland Empire, California. Do you have any advice? Yes. Look up, and this for anybody that's trying to get a job and having trouble. Look for some recruiting agencies in your area. I always tell you guys they get paid to find you a job. So reach out to some recruiting agencies in your area. Also, Indeed, you can't go wrong with Indeed. LinkedIn is a really good one now. LinkedIn has gone has completely turned into an employment site now. It wasn't always that. Well, it was for making connections and stuff like that, but now it's really just as much of a job site as Indeed is. Also, going around to some offices, putting on some professional clothing, maybe a blazer, some slacks, printing out copies of your resume, and going around to some private offices in your area. Yes, Vanessa, khartcpr at gmail.com. And I'll say it again. It's KHEART, Heart, well, Khart, KHEART, CPR at gmail.com. KHeartCPR at gmail.com. Is that Michelle? Hi, Michelle. I'm happy to see you. I'm happy to see you too, Michelle. Bella, and I broke my leg. I'm sorry to hear that, Bella. Point of care testing. Okay, Tanika, thank you for adding those. So metamorphosis, Tanika added some more things you may have to do. Rapid flu. Yes, flu, COVID, strep, hemoglobin A1C, glucose testing, possibly cholesterol testing. It's so many family practice is so many different things. So you maybe can even start there too, metamorphosis, just looking up videos, what it's like to work in family practice, or what are some skills I need to know for family practice. But it's so many different things because family practice is often primary care. So this is where patients come first. Okay, this is where they come for their referrals to the specialist. So you're probably going to be doing referrals as well, a lot of prescription refills and stuff like that. So it just kind of depends on where you work. Some offices have somebody for everything. So you may not have to do all of those things, but to just be prepared. I took the AAMA 8 years ago and I failed by a few points. I never wanted to retake because I was discouraged. Now I'm going to try the NHA and my brain is, I need to study. Okay, go to marefreshercourse.com. So this is an exact example for somebody who needs the MA refresher course because you need a refresher and you want to get the clinical course because it has both administrative and um and clinical information. So you want to go there and get that study guide. Don't know where to start. Start there, marefreshercourse.com. You can also check out my videos as well. But because you've been out of school for so long and you took that test so long ago, I would suggest a refresher for you. You're welcome, Irene and Vanessa. Thank you so much, Island Goody LLC. Thank you so much. A new MA. I'm in internal tips for a new MA. I'm in internal medicine. So yeah, brand new. So I mentioned a couple to somebody earlier. So definitely be open about the fact that you're brand new. As they're showing you around when you get to your new job, just let them know, if you want to watch a few times before you do anything, that's perfectly fine. Because I'm pretty sure you're going to be shadowing somebody anyway. They probably going to do that anyway. But before you do anything for the first time, if you're not comfortable, always let them know, is it okay if I watch you a little bit longer before I do it? Also, make sure you have your notepad and stuff so you can take notes as they're explaining everything to you. Get there every day early. You want to, of course, get there on time, but I suggest being early. And then also, making sure you're taking initiative, get there early every day, see if they need help with anything. Even if they don't, at least offer. And then just also, as I mentioned to somebody else that's about to work in family medicine, you may want to look up videos on some of the skills you'll be doing in internal medicine. So vitals, EKG, because internal medicine is another one that's primary care. So you do a lot of things in internal medicine as well. Internal medicine and family practice are similar, but internal medicine is usually adults. So you're not going to really be seeing like babies and little kids. And so you're going to be doing a lot of different things. So looking up, skills videos that like Tanika mentioned, rapid flu, rapid COVID testing, pregnancy testing, finger sticks, glucose testing, and things like that. Taking eye exams. So I would recommend just looking up different skills videos on that so you could be prepared for some of the things you're going to be doing. Of course, getting to know your doctors. I don't know if you're going to be assigned to one doctor, but if you are, you want to just get to know that doctor. Every doctor is different. So you want to get to know that doctor or nurse practitioner or PA, whatever type of provider you'll be working for. And then, of course, just take notes whatever, whatever preferences they have. So like for an example, the EKG practice, I'm remote right now, but when I was in the office, we had a preference sheet where certain providers they like certain things. So like our cardiologists, they didn't need an EKG every single time a patient came in. Some of them preferred every 3 months, some every 6 months. You know what I mean? Some every year. If the patient had one in the last year and they don't have symptoms, they're okay to not have another one. So just kind of learning that your preferences for your doctor. Do you give healthcare advice? So yeah, to an extent, like I don't give healthcare advice in a sense like what you should do personally, but I just give healthcare advice in the sense of working in healthcare. But I don't give like medical advice to a situation you have going on because I don't want to be liable for that. And plus, I'm not a doctor. I don't know everything. A lot of times people think because you can anybody relate to that? Do me a favor, let me know in the chat if anybody relate to that. Soon as you get in the medical field, a lot of people think you know the answers. And then if you don't know, like I had my cousin, her arm was hurting and I couldn't tell her what it was. She like, I thought you was a medical I'm like, I'm not a doctor. I don't know everything. They think you know everything. So yeah, I don't give medical advice. I don't know everything. And I don't want to be wrong and then tell you to do something and then it's not right. Because we're not supposed to advise as medical assistants anyway. It's beyond our scope. So no, but how to work in healthcare, yes, I do. The program I work in was going to take 4 months. Do you think it'll be stressful? So I won't say it's going to be stressful, but because you have 4 months, it could be, it's a lot to learn in 4 months. So you definitely want to have a schedule on the days and hours you're going to be studying and try to keep your stuff separate. So keep your administrative separate from your clinical stuff. So as you're studying and taking your quizzes and stuff, you can easily get to those notes. But you just got to have a schedule. Guard your time. So when you are studying, phone should be off, no distractions, and stay organized. That's what's going to help you not be stressed because honestly, what makes us stressful is when we are unorganized and it makes us feel overwhelmed. And a lot of times it's only because we have no organization. So it's not necessarily a stress that is stressful. It's just that we're just kind of all over the place and stay up to date with your work. Because as soon as you fall behind and you have to do multiple things at one time, now that can become stressful. So you want to stay up on every single thing that you need to do. Assignments got to be turned in on Monday. Have that assignment in by Monday, because then guess what? Tuesday you probably gonna have something to do as well. So but yeah, it doesn't have to be stressful, but it's a lot at in a short amount of time. So another thing I would say to that for anybody that's in an accelerated program, you're gonna have to do a lot of things on your own. So watching videos because y'all gonna be moving fast. Because like my students, the program that I was working in was 3 months, 12 weeks. So my students was responsible for watching videos outside of class. And then when we come into class, you got to be ready to do those skills. But you got to watch the videos on your own and be ready when you get to class. Jacqueline says, have you ever felt burnt out in a job and how did you deal with it when you were trying to hang in there? Burnt out at a job. I have felt burnt out at a job before. And I know it's easier said than done, but I just continued to work until I was able to find something new. And I just believe in doing what I can and I can't stress myself out and kill myself trying to, you know, trying to do a job, right? Because if you're burnt out, obviously that probably means that you're doing a lot, maybe the job of multiple people. So I would just say do what you can and really, you know, don't take yourself out trying to now of course do your job. I don't want to tell anybody to get lax and not do your job, but do your job to the best of your ability. Like when you're giving 100%. And then in the meantime, of course, you want to talk to your leaders about it, your management about what you're dealing with and how you feel. I'm big on communication, so I'm always going to tell you guys to talk to your leaders. Talk if you're in school, talk to your instructor. I'm very big on that. I would never. You got to let people know what you're dealing, how you're feeling, and what you're dealing with because they could feel like you're okay with it if you're not saying nothing. Oh, she doing it. She here every day. She's okay. So I'm big on communication. So being honest about it and then trying to find something in the meantime. But I never recommend hurting yourself because, something happened to you. They're going to feel your position that same day. You know what I mean? So You're welcome, Funk Congress. What? Wait a minute. I just thought about what I just said. Yeah, I'm not saying that. This is this person's name. I promise y'all I did not say what y'all think I just said. That's their name on YouTube. It says Funk Congress. I'm not saying that. That's their name. Do you have videos on an MA refresher course? Yeah, I have videos on it. Oh, you mean like skills videos? Did I upload? I think I uploaded videos from like my YouTube channel, but there's like if you're talking about skills videos, now there are videos on there of slides. So the way that it works is I have slides where I'm teaching a lesson. So just like when you were in school and your teacher showed a PowerPoint slide, so I'm going through PowerPoint slides, and then there's a quiz after each lesson. So once you watch the video, watch the lesson, there's a quiz. And then at the end, there's 12 modules altogether. So each module has video, lesson, as in slides. And then there are some modules where I uploaded videos from my channel. And then after the video, the lesson, you take a quiz and you go to the next lesson. And then at the end, there are 3 practice tests. So over 400 practice questions are on the clinical MA refresher course. I have to tell my mom, I don't know, I'm not a doctor. Yeah, it's like soon as you're in a medical field, and then if you don't know, it's like, what you mean you don't know? Aren't you an MA or aren't you in the medical field? I'm like, listen, I'm not a doctor. Thank y'all for the love reactions. Do me a favor and exit the chat and like the actual video. That helps a lot. If you guys see the hype option, make sure you press that as well. Is it okay to jump to different specialty? Of course. If you don't want to try just one, of course. Yes, you can. Is that Deja? Yes. Is it okay? Definitely. I recommend it. If you want to get to know different specialties to see what you like, I recommend like working in a practice like family practice, or if you want something more fast-paced, urgent care, because you're going to be doing so many different things, and doing so many different things is what's going to help you realize exactly what you want to do. But yeah, if you're in a specialty and you want to switch, absolutely. Yes, absolutely. You're welcome, Margarita. I will be watching your videos and taking notes. Yes, please take notes. When y'all are watching the videos, I hope y'all are taking notes, especially as you guys see things that you didn't know. I hope y'all are adding that stuff to your notes. That's how you study. Somebody asked me, how do you study? That's one of the ways you study. When you're watching the notes, I'm sorry, when you're watching a video, you're taking notes. You're adding stuff to the notes that you didn't know. Jaquay, hey Jaquay says, I passed my exam last year watching you. Awesome, congratulations. That makes me so happy to hear. All right, y'all, I'm about to get ready to get off here. It's Friday night. I need to eat something. Jasmine, hey Jasmine, I love your content and your teaching. Thank you so much, Jasmine. Thank y'all for checking in here. Do me a favor before you guys leave. Just let me know where you are, if you're a student, where you are in your journey. Just do me a favor, let me know that, and I'm gonna get off here in a few minutes. Jasmine says, "Love your study guide." Oh, Jasmine, thank you. I'm glad you're liking it. So Jasmine has my study guide, which is what I was talking about a minute ago, the MA refresher course. I'm glad that you're liking it. So yeah, do me a favor as you guys are leaving. Just let me know what your status is, student or already working. Is it possible to take my exam if I've been out of school for a long time? I was never certified, but I was employed as an MA, or will I have to retrain? No, Robin. So you don't have to go back to school. I created the MA refresher course just for people like you. It is pinned on the screen. So it's the MA refreshercourse.com. Jasmine put it on the in the comment section, and I have it pinned. But you just need to click on that and go to the clinical course, and I have video lessons on there, PowerPoint lessons. Well, slides. I didn't use PowerPoint, but I use slides. And then there's quizzes and then practice questions. And I've had so many people pass from taking my certification prep. Any medical coding or know anyone that so look up oh, you said jobs. Oh, no, I don't. No. So that's another thing. Another thing I had just mentioned, Indeed, looking up recruiting agencies. No, I don't know of any medical coding job. Take my exam next month. Good luck with that. Good luck with that. All right, guys. You're welcome, Robin. You're welcome. I'm not sure where to start studying. I take my exam next month. So Kareem, your exam is next month. So it kind of depends on what you have, what kind of study material you have, but you can start with watching my videos. It's hard to say where you should start because I don't know which exam you're taking, and then I'm not sure where you are. But if you haven't already, make sure you go through, if you have your study material, you go through all the modules, starting at module one. If you've already gone over some, finish the rest of them, take your practice test, but in between each practice test, make sure you are studying because you don't want to keep getting the same score. So it's kind of hard to say where to start, but you definitely want to start because you got a month. A month is actually really good because you got time. You can check out my videos as well. Will your prep help me in just a couple of days? When is your I can't Vanessa, are you the one that's taking your test on the 17th? It can, Vanessa, if you let's say you get it, if you got it tonight, just I will go through it all weekend. If you don't have time to do it this weekend, then I wouldn't get it. I would only get it this weekend if you have time to actually do it because I have 12 modules altogether. And if you are able to hone in this weekend and go through them, I would say yes. If not, then I would just say, you know, if you don't have time to go through it, I wouldn't get it. Only if you have the time. So yeah. Uh hey, fine, I don't know what that means. But hello, Joe. What you talking about? MA stuff. Are you an MA, Joe? All right, guys. I'm going to email you. Yep, that's fine, Jacqueline. Thank you, Jacqueline. All right, y'all. Let me let y'all go. I don't see any other questions popping up. But yeah, Vanessa, to answer your questions, only if you have the time this weekend. I don't want you to just get it and then you don't have the time. All right, y'all. Y'all have a good night. What? Do you have a question about medical assistant? I've been on here for 37 minutes. Medical assistant. MA is a medical assistant. The people that take you to the back when you go to the doctor's office, that's a MA, medical assistant. Let me see. All right, y'all. Y'all have a good night.